Diabetes ICD-10-CM Coding, a complete guide. Welcome to Diabetes ICD-10-CM Coding. In this video, we will explore the types of diabetes, how to code them, insulin usage, diabetic complications, and official coding guidelines. What is diabetes? Diabetes mellitus is a chronic disease that affects how the body processes blood sugar or glucose. It is classified into different types based on its cause and progression. Diabetes affects millions worldwide and is categorized into different types in ICD-10-CM. Types of diabetes in ICD-10-CM codes. E08, diabetes mellitus due to underlying condition. Secondary diabetes caused by an underlying condition, such as pancreatitis, Cushing's syndrome, or cystic fibrosis. Common causes: chronic pancreatitis, cystic fibrosis, Cushing's syndrome, malnutrition, genetic disorders. Example: codes: E08.9, diabetes mellitus due to underlying condition without complications. E08.22, diabetes mellitus due to underlying condition with chronic kidney disease. Additional coding guidance. Code first the underlying condition, such as K86.1 for chronic pancreatitis. If insulin dependent, use Z79.4 for long-term use of insulin. E09, drug or chemical-induced diabetes mellitus. Diabetes resulting from long-term use of medications or exposure to chemicals. Common causes: steroid-induced diabetes from corticosteroids, drug-induced diabetes from chemotherapy drugs, poisoning by chemical substances. Example codes: E09.9, drug or chemical-induced diabetes mellitus without complications. E09.42, drug-induced diabetes with polyneuropathy. Additional coding guidance. Code first poisoning of drug. Use additional code for adverse effect of drug. E10, type 1 diabetes mellitus, an autoimmune disorder where pancreatic beta cells are destroyed, leading to absolute insulin deficiency. Characteristics: typically diagnosed in children or young adults, also known as juvenile diabetes. Requires lifelong insulin therapy. Example codes: E10.9, type 1 diabetes without complications. E10.21, type 1 diabetes with nephropathy. E10.649, type 1 diabetes with hypoglycemia without coma. Additional coding guidance. Do not use Z79.4 for long-term insulin use, as all type 1 diabetics are assumed to be insulin dependent. E11, type 2 diabetes mellitus. The most common form of diabetes characterized by insulin resistance and relative insulin deficiency. Characteristics: primarily seen in adults but increasingly common in younger populations. May be managed with oral medications, lifestyle changes, or insulin therapy. Example codes: E11.9, type 2 diabetes without complications. E11.40, type 2 diabetes with neuropathy. E11.65, type 2 diabetes with hyperglycemia. Additional coding guidance. If the patient is on long-term insulin therapy, add Z79.4. If the patient is on oral hypoglycemic drugs, use Z79.84. E13, other specified diabetes mellitus diabetes that does not fit into the above categories, including genetic or idiopathic types. Examples: post-pancreatectomy diabetes, maturity onset diabetes of the young, MODY, latent autoimmune diabetes in adults, LATA. Example codes: E13.9, other specified diabetes without complications. E13.21, other specified diabetes with nephropathy. Additional coding guidance. Code first any underlying condition, if applicable. Use Z79.4 if insulin therapy is required. How to code diabetes in ICD-10-CM. Step 1. Identify the type of diabetes, E08 to E13. Step 2. Determine the presence of complications. Step 3. Check if the patient is on insulin. Step 4. Assign additional codes for complications. How to code insulin use. If a patient is on insulin, code Z79.4 for long-term use of insulin. For long-term use of oral hypoglycemics, use Z79.84. For long-term use of injectable non-insulin drugs, use Z79.899. How to code diabetic complications. Diabetes often leads to complications. Always check documentation for specific conditions. Common diabetic complications and ICD-10-CM codes. Diabetic retinopathy, E10.319 for type 1, E11.319 for type 2. Diabetic neuropathy, E10.40, E11.40. Diabetic nephropathy, E10.21, E11.21. Diabetic ketoacidosis, DKA, E10.10, E11.10. Diabetic foot ulcer, E11.621 plus L97 for the ulcer code. Diabetes ICD-10-CM coding guidelines. Code first any underlying condition for secondary diabetes. Diabetes with complications requires combination codes. Code insulin use if not documented as type 1. Diabetes coding examples. Example 1. Type 2 diabetes with neuropathy on insulin. E11.40. Type 2 diabetes with neuropathy. Z79.4. Long-term use of insulin. Example 2. Type 1 diabetes with DKA, E10.10. Type 1 diabetes with ketoacidosis. Example 3. Secondary diabetes due to pancreatitis, E0, 8.9. Diabetes due to underlying condition, unspecified, K86.1, chronic pancreatitis. Conclusion. Understanding ICD-10-CM guidelines is essential for accurate diabetes coding. Always review documentation carefully to assign the correct codes. For more coding tips, subscribe and stay updated.